Hello and welcome. This is Susan Lopresti, and you are listening to the Susan Lopresti Wellness Mind, Body, Soul podcast. I am so grateful that you decided to join me here today, and I'm really looking forward to sharing information with you today about a common issue for women in midlife and older, which is called pelvic floor dysfunction. You may not have heard about this before because it can be a sensitive and oftentimes embarrassing topic to discuss. But if you're having trouble with incontinence, meaning that you wet yourself if you laugh or you sneeze or you cough, or worse yet, have feces leakage, then you really need to stick around and learn more about this topic because you can make this condition better, and I'm going to show you how. We are talking about what it is, how it occurs, and what we could do about it. And I will talk about ways to strengthen your pelvic floor. As with any transformation, please keep in mind it's your workout, your time, and your body, and you own it. Some days will be more challenging than others, but use your goals to keep you motivated. Before we dive in deep, let's review some anatomy. So, the pelvic floor is made up of supported muscles, tendons, and ligaments at the base of the pelvis. These muscles stretch like a trampoline from the tailbone to the pubic bone. Even though the pelvic floor is hidden from view, it can be consciously controlled and trained, much like we would train our arms, our legs, or our abdominal muscles. The pelvic floor supports the functionality of the bladder, the uterus, the vagina, and rectum, providing support and stability to the organs of the lower abdominal cavity. Additionally, pelvic floor muscles are also important for sexual function in both men and women. There are a number of factors that lead to a weakened or loosened pelvic floor muscle. This is most commonly a result of childbirth. For men, common causes of weak pelvic floor muscles include surgery from prostate cancer, bladder or bowel problems, including constipation, heavy lifting, and more. Some additional causes for it are pregnancy and childbirth for women, straining on the toilet, a chronic cough, heavy lifting, high impact exercises, and then, of course, come age and obesity as well. In most cases, it is possible to tighten the pelvic floor muscles and regain control. So let's take a closer look. During pregnancy and childbirth, the pelvic floor muscles get completely stretched out, first from the weight of the baby, and then hormones are designed to loosen your tissues when you're pregnant, and the efforts of labor as well, and these muscles really don't stand a chance against all of this. So, severely weakened pelvic floor muscles, usually following several pregnancies, can cause pelvic organs to slip into your pelvis. This is called pelvic organ prolapse. Prolapse gives you this dragging feeling in your vagina because your womb, your bowel, and the bladder are now dropped in and they're pushing against the walls of your vagina. This condition is more likely to happen later in life as you age rather than right after childbirth. Doing pelvic floor exercises after childbirth will prevent and also treat incontinence. It improves the circulation of blood to your perineum, which is the area between the genitals and the anus, which will help to reduce any swelling and any bruising. You also can rebuild strength in your pelvic floor. So remember, everybody is different. You want to check with your health professional to decide how soon after labor it's safe to begin pelvic floor strengthening exercises. But keep in mind, you could do this at any age and you will see results. So, additional causes of a weakened pelvic floor are attributed also to aging and obesity. So, for those women who never had a child, you may still develop a weakened pelvic floor just due to aging and also if you're overweight. Weakened muscles in general is common with age, right? We all know that, of course. Pelvic floor exercises can be done, like I said, at any age to improve conditions associated with a weak pelvic floor. Being overweight for a long period of time can also place more considerable strain on the pelvic floor, increasing the risk of leaking urine. Pelvic floor exercises, as well as weight loss, can really be beneficial regardless of your age. And an additional note here that I want to just mention is if you do suffer with chronic constipation, you should have that cause addressed by a health professional to help prevent pelvic floor damage because there's many ways that we could relieve constipation. That's a topic for another day, but I just wanted to let you know. So let's review the benefits of strengthening the pelvic floor. The benefits include increased sexual sensation and orgasmic potential, increased social confidence and quality of life, improved bladder and bowel control, which is really important, improved recovery from childbirth and gynecological surgery, improved recovery after prostate surgery, and also reduce the risk of prolapse. If you identify with what I'm talking about, there is help out there. Exercise can do a world of good to help maintain and strengthen the pelvic floor. First and foremost are Kegel exercises, which use the muscles to help you urinate. Using these muscles when you urinate, you can work on trying to stop the stream of urine and then starting it again as a way to engage these muscles and strengthen them. There are also several yoga poses which help to engage those muscles to strengthen the pelvic floor, such as bridge pose or doing planks. Also, cat and cow pose will help you with that. You can also do some research on the web for a full range of exercises. Or another great suggestion is you may want to speak to your gynecologist who can suggest that you see a pelvic floor therapist who's actually a physical therapist, but they specialize in strengthening the pelvic floor. So that's also a great option. As well as your doctor may also prescribe an estrogen cream as a suppository, which you would basically put inside of your vagina to help to strengthen the pelvic floor muscles as well. And we all know that as we're aging, we're losing estrogen, and estrogen plays a vital role in so many of our bodily functions, including keeping the pelvic floor muscles strong. So that's a wrap for today. I hope everyone learned some valuable information regarding the importance of a strong pelvic floor, how to locate the pelvic floor muscles, and the benefits of participating in strengthening exercises done regularly. Until the next time, stay positive, keep smiling, and stay well. Thank you for joining. Bye for now.